So I think our goal for this half hour or so or less was to try to get everybody thinking in a focused way about next steps. As sort of a continuation of the conversation we started yesterday. What has this day raised for you as potential issues that might be candidates for workshops, for working groups, for collaboratives, for papers, for other things. So we could sort of get a first response this afternoon, and then potentially our summarizers who are listening carefully for the last through tomorrow will help us do that sort of towards the end of the time. I'll kick off, but this is at great risk, but I sort of was thinking as I'm looking back over my notes and thinking about what people are saying, I was thinking about sort of 4 buckets of things that seem to emerge, and I'll just throw them out there. One of them was this area that you might call global health security. It started yesterday with the discussion we had about using Ebola, just sort of Patrick started it, to sort of provoke thinking about what's the proper investment in emergencies, how do we set priorities, and it sort of connected to things we talked about, health system stress tests and resilience indexes and capability and preparedness response. So it's this sort of category, I guess, of emergency response preparedness. What would we learn if the private sector, public sector, if everybody sat together before it happens and thought about what are their considerations, how are they thinking about this stuff? The second bucket seemed to me kind of started out with what Scott Ratson had said. I'm going to put the umbrella as health behavior change, which had to do with public awareness. We talked about health literacy, measuring community well-being, community engagement, developing trust, this whole sort of constellation of issues about public engagement and political accountability. I mean, Francis talked about it. Everybody's sort of raised it in a different area. That's why I said it's a bucket. Excuse the lumping as opposed to the splitting. But it's just this area of engaging the public, educating the public, so they can be partners measuring the effect of that. The third one was this area of partnerships, and I think we've talked a lot about it. But I was also struck with a discussion this morning, I think it was, about this horizontal vertical question. And I think somebody linked it to the sort of final criteria of the MDGs unrealized last time, which was effective partnerships. And clearly that's another one on the list for the SDGs. And playing around with, there were thoughts about, might we think about what a model for, models for partnership, checklists for partnership, toolkits, but something that kind of informed the global conversation about, sort of vertical, horizontal sustainability, our model. I think the term our model came up a few times. And so I, again, raised that because I was looking at some of the, like the CARE framework, our colleague who just talked about the sort of PSR version. I mean, I think that everybody, even some of you all had literature reviews that you were using to abstract from, which I suspect that the corporate community wasn't reading the NGO Continuum report from 2011. So it just struck me that if everybody kind of put their heads together, there may be a space there to think about it in terms of future stuff, not present, but if we really are thinking about these global networks or global changes in the system going forward. And then the fourth bucket, it was like 4.5, but the fourth bucket was really provoked, I think, by Laura's presentation this morning, this sort of corporate philanthropy, corporate social responsibility, shared value continuum, as she talked about it, but also the need to be able to have all of it in your toolkit as a company, and that they had different purposes. And linking to Francis's comment about aligning business models with development needs, and sort of were there structured dialogues that could be set up so that if people are coming to Africa or Latin America or low-income countries, are they aware of the plans that these countries have in which they're trying to articulate what they're trying to accomplish? And is there a way of having dialogues that really brought those pieces together, this economic development for health together, and The partnership issue and this issue kind of links to Carol's fairness question. I think that I wanted to include the fairness index as part of the partnership discussion. And then there were two other quickies. There was a burst of interest on the first evening we met on antimicrobial resistance. People sort of said, might we think about that differently if everybody was around the table at the beginning rather than only the scientists dealing with this sort of stuff? And then just to bring back the regulatory frameworks discussion that Kate introduced as an area of conversation. So those were my sort of buckets and a half.
So my buckets were very, very similar around community engagement. You've talked about that. That was one. Preparedness was another one. I felt that you talked about our model. I felt that something like, what are the basic rules? Because we've heard from various presenters about these are the things you need to bear in mind. And when we first started out on this journey, about a year ago, we first of all talked about, the alignment of, we needed the alignment of objectives and measurement of outcomes. It wasn't until somewhere along the course that we started to talk about the need to possibly course correct during a program, the need to communicate it, the need or the discipline of retiring it when it was finished and that was appropriate, or to change it into something else. And I'm going through that at the moment with a very substantial program of ours because the science has changed in the interim. And we need to be driven by the data, and we need to recognize that partnerships and programs are an opportunity to collect data as well and to collect scientific information and to use that. So I think something to come out of this that would give us a roadmap or what the public-private partnership journey should look like or might look like. That had some basic rules around governance, etc. And also the global leverage. I was particularly taken by James's presentation, by Catherine's presentation around sharing of capabilities. And I just think there should be more of. I think there should be more of that. Mm-hmm. So I think I call that my bucket. I'm calling it global leverage, but I think that is something. So I think we're in the same areas.
What about other people? I mean, just to throw out some ideas, because we have good note takers. We're recording this, and we'll come back. We'll kind of clean it up. Yes, co-chair, Clarion.
I found incredibly interesting that all the speakers addressed is that they were all in the moment. They all described some period of time when they were on their voyage, on their journey, where where they were at the moment, they understood the ramifications of everything that they were doing, which is, we're always talking about going forward or where we've been, but taking in a real-time assessment where you are at each and every point in your journey is so incredibly important because you point out assets you have that you're not thinking about. So I really found that incredibly interesting because there's so much to be gained by looking at that, because it's always what you don't have, what you haven't done.
I think it gets to that partnership journey. If you are aware of where you are in the journey, you know what you're looking at. Yes.
Other comments, please. This is just a kind of free-floating brainstorming, throwing it out. Yeah, go ahead. Put the 10 cards up so we can see your names from a distance. Okay, Jim Jones.
Jack, you mentioned this, but I think it bears kind of teasing out a little bit. I heard a number of people today talking about the notion of governance, and I think it's vitally important, and I know you mentioned it, but I think it deserves its own treatment. Who's actually setting the agenda, both at the macro level in terms of global health, but also microcosmically? Who's setting the agenda of individual partnerships? I think that becomes a key element to whether they succeed or not. And then who are the stakeholders? How accountable are they? How appropriate is it for various sectors to play various roles? And I know we haven't discussed this here, but there clearly has been in the past, and you both have mentioned this in previous sessions, a great deal of distrust among various players that are in this room right now, but that hasn't gone away entirely. So I think we need to, kind of talk about how we all kind of relate to each other in the present day, to Clarion's point. Where are we in that journey right now in terms of collaboration and cooperation among various sectors?
Yeah.
I think Jim is appropriately raised who's setting the agenda on a macro level, but picking up on Susan's points, I think who's setting the agenda at the micro level within the partnership is also important. And I almost feel like there should be like an airline category, like a gold, silver, platinum status within some of these partnerships, because I think sometimes people are bringing resources, sometimes people are bringing in-kind assistance, they're bringing different things to the table. And we do probably overuse the word partner sometimes, and I think we need to be a little more careful about distinguishing who's a strategic partner, who's a financial partner, a resource partner, and what sort of status they have in the partnership. I think that would help us in the governance piece.
Carol?
I have two related issues. The one I think that George brought up earlier, and it is that the community is often missing out of the partnership discussion. And I think that should be in the buckets somewhere, because in all those partners and who you define, we still don't have the beneficiaries, if you want. And so somehow they should be in. And then related to that is, I think this is a very panel, a group of people that are all experimenting and believing that public-private partnerships are going to do great things. But somewhere there will be limits, and I haven't heard much about what it is that it can't take. And if you don't have industry, or if you have unpopular topics, or unsexy environments, or why is there water for children and not for their mothers? For me, there are limits in which PPPs can operate, and I think it would be worth for a panel like this to consider those as well. So where are the boundaries?
One of the things that I think often gets lost, I know it does in my industry, is when we're talking about what our aligned goals are, and the company wants this and the NGO wants that. And we're all doing this because vulnerable people need help. And it is their lives that we're trying to improve and to save. And that needs to be at the forefront of everything that we do. That these public-private partnerships are there to make a significant difference to people's lives. Then everything else should fall into place. The return on the investment, and the building the capacity for the next disaster and all of that. But at the forefront needs to be the people and the communities and the populations that we're trying to help. And I think that gets lost in all of this.
Okay. Let's see, Kate Bond, and then let's just start this way. We'll go Kate, Dick,
Francis,
and Ambassador Lang, and then we'll start over here.
Pat Day.
Yeah.
These are sort of random thoughts in no particular order of priority, but themes or issues that have sort of been latent in this discussion. One is the business case, and the idea that there are different or new models to assure partnerships for which the result can be sustainable, whether the partnership itself is or not. The second, I think, is what appeals to me in terms of what you described as the vertical, horizontal, and that is more sort of thinking about things in networks, in terms of interconnections or networks. In addition, Jack, to what you were saying about looking at the rules, I think understanding better the structures and the properties of those networks, and when there are certain forms that meet function. And then the third is really about conduct, for lack of a better term. In the organizational development sphere, there's a lot of writing about leadership. There's discussions, in terms of how people engaged in partnerships can conduct themselves to assure that it's more likely to be a success. Understanding where the points of tension are, anxieties, really recognizing that this is actually quite a unique skill set, which requires cultivation, requires understanding.
Mm-hmm. Dick, Ambassador Lang, and then...
Following up, Jack, on your point about what are we really all about? It's being concerned about vulnerable people. And I would like to press that a little further and to say that as we think about who sets the agenda, how we engage the community, who we listen to, what do you want as opposed to what another person wants for you, and maybe even press it to the point, to Susan's analogy, that maybe we are all in one kayak together. At least we're heading down the same river, and we are sort of tied together in more ways than I think we have begun to admit. That that ultimate interdependence is critical to what our collective agenda needs to strive for. There are a lot of interim goals and ways to get this kayak part the way down the river, but the kayaks are sort of tied together in a lot more ways than I think we realize. I think the Ebola situation is but one more example of that, and I think we may evolve to the point where we begin to realize that we're in it together, that how you do determines how I do, and no matter where I am or you are. And so I think we need to start articulating that because it's that shared vision that I think can stand the best chance of helping us to harmonize our goals and what we do.
I was sort of, I think that's a great aspirational goal. I was struck by the different presentations. Some people, a couple people presented and said, I can't do what I do without partners. And other people said, well, I need a partner for a gap. I need a partner for this. So I think there's a really interesting space there to explore a little bit more, is how do you get to that, shared vision? It's a really interesting challenge, I think. Ambassador Lang, and then we'll start back over here because people are on this side. It's not fair. I'll come back to you, Luis.
Thanks, Joe. I just wanted to emphasize what Jack had said about community engagement and then what Carol emphasized. I thought some of the most important comments today were Dr. Amwaso's discussion of the importance of the economic, political, cultural, social context within a country to have an impact. And we saw a lot of logos on the screens today, and very few of them were from the developing world, if I recall correctly. A lot of corporations and development assistance agencies from the rich countries and UN agencies and others. And really, you can talk about all these things and we can come up with all kinds of public-private partnerships, but in the end, if they don't take into account and understand and have acceptance by the people in that community, in that country, they won't succeed to anywhere near to the extent that we hope that they will. And I really think that's an important point that we cannot forget.
Francis, do you want to pick up on that?
Yes, I'm moving on from Ambassador.
Can you bring the mic a little closer to your mouth?
And also the point which Jack Waters made, I think he used the word roadmap. I would like to build on that. In that triangle which moves the mountain, the private sector has been missing on the left lower side of the triangle. WHO has debated now openly the role of the so-called non-state actors, but they are moving too slowly. Over lunch, I was sharing with Sir George about why that is. So the roadmap, which you have mentioned, should now include what we do to get the private sector firmly on the table as a key player in global health. It is happening already anyway, but in a way in which, like, the governments are shy, the UN is shy. Why are they shy about something which is real? And from here, it's open to us to suggest what the next steps will be to get this agenda actually to become agreed as something the world needs to take on?
Well, I found it very disheartening. I thought last June, May, June, we had almost got WHO to the point where they saw non-state actors, non-government actors at the table, and then that was deferred and put off until next year, way into next year. So I think we need to design our own roadmap because it's happening and we're there. And we've heard from so many people today that they couldn't do these partnerships without honest, in good faith partnership with the private sector.
There are many we have not talked about today,
Yes.
many that I know. A lot of hospitals, for example, in our part of the world are depending, the public sector budget is just not able to keep them
Yeah.
going. And it's the private sector which chips in here, there, and so on. And no one is complaining about that.
Yeah.
No one is shy about that. But then when they go to Geneva, they are shy about it. So let's find a way of making it, something not to be shy about.
Well, clearly they should just stop going to Geneva. Elaine, I think you had.
We'll take the council, the members of the round table first, and then we'll get the folks around the table.
Okay.
Sorry, I wasn't not seeing you.
Yeah, so my point really echoes from what Francis was saying, and it goes back to Joe, to your comments. That really, to me, we have to segment the model conversation into two, and that may be overly simplistic, but the external model is changing. So this is happening, private sector is engaged. What would be really, I think, beneficial for this organization to come out with is, if a roadmap is the right term, that's fair enough, but is a view on how we can do this in the next generation. So it's about a different kind of partnership in totality, right? It doesn't look like a private-public partnership looks today. It's quite a different conversation. And they are happening. I mean, PATH is actually having those conversations where it's all about a statement of work. I mean, there's a governance structure that is very simple. And it comes from a very clear set of mutually agreed upon objectives. And so I know it can happen because I see it emerging. I think the other part of that, the model conversation, is the internal model. And I can see it now, not from the private sector standpoint, but from the NGO standpoint. And that is that a great, just little working example would be we don't actually have the funding to continue a protracted discussion of the sort I'm discussing for 18 months with a private sector player without funding to do that. And so it's a very different model internally, where you have to get your resources to sit down over a long period of time to broker the agreement, create the conversation, and you have to fund that. And so our own internal model, both from an infrastructure standpoint, a funding standpoint, a talent standpoint, is actually broken. And so until we can fix both of those two things, I don't think we're going to make the progress we need.
Let me get to what Dick was heading for, which is if you take it from the point of view of what's the goal, the statement of work, versus characterizing the partnership by who's participating in it, it opens up a different set of conversations. Very interesting, yeah.
Yeah, I mean, I just going back to the buckets, one that I think we've touched upon but haven't really called out directly is really partnering for innovation. And by that, maybe changing the roadmap to what Elaine was saying there, so that it's not always top down, but that we're really getting what's needed from the community and building that together, whether it's a technology or, more importantly, changing the approaches to the delivery, the approaches to the development.
It's innovation in any of its forms,
Yes.
I think, that we can have. And I think that gets, again, back to using community engagement to help shape the research agenda, however you want to consider the research agenda. And I think that's really important.
Did you give up?
Thank you. My name is Martina Gliva. I work at Institute Marieux. I think it's really important that what everybody has underlined here, that we have to start really from the needs of the beneficiary countries and the low-income countries. And another point that I think is important on partnerships is the moment when we start discussing with the partners. Sometimes I saw in my experience that a project was set up, and once the project was set up, we start looking for partners. But I think if we would, the partner would like the partnership to be efficient and to make it work, is to involve the partners right from the beginning. So the time, I think the momentum is important, and to start setting up the partnership together from the starting point, from the needs analysis with the different partners, and then to move on together.
Yeah, sorry. Hi, I was just gonna say, is this the microphone? Okay. I felt like there were a treasure. Oh, my name is Sarah Gelfand, and I work at Duke University. And there were a treasure trove of examples here of different partnership models. And I think one potential takeaway would be to sort of synthesize those and put out organizing principles, sort of framework or rubric for others to learn from what all has happened here, and with what specific goals or settings do what kind of engagement models or structures look like that lead to the best success. And then I think this at this point may be derivative of comments others have made, but it does feel like so many of the partnerships that get talked about in a room like this are at a very large scale. And I work with, nearly 50 organizations that are much smaller scale, and some of the best early stage partnerships and experimentation or innovation happens in smaller, like partnerships with less than grandiose ambitions. And I think some of that ought to be fed into this dialogue as well.
I just want to build on that comment a little bit, and I was a bit remiss in my presentation earlier where I didn't talk about the CBOs that we also work directly with. I kind of mentioned a lot of the people in the forum here that represent some INGOs and some of the large global actors in this effort. And I would say some of our most best learning models have been with individual organizations where, for whatever reason, we've come across and we've learned with them. I can think of one in Kampala, actually, that Francis may know, with Alive Medical Services, who has a very strong HIV treatment and care program led there that actually was one of the very first ones we saw that integrated both nutrition and HIV care and then added clean water. And that was this shining example of integration. And we've taken that case study or that story around to all of our other partners and said, we realize they're a little smaller, we only have to talk to 2 people, but that's an example of what we want to reach with these other organizations we work with around the world. So I do think that some of the small, innovative and sort of testing grounds or folks who are willing to test and learn quickly can really inform what we do on a much larger scale. And so I think that's important for us not to lose sight of those direct relationships in the CBO organizations.
Lots of really good ideas there, and I know that our note takers have probably come up with some good ideas, because not only were we trying to summarize the day a little bit as best you can, but also to get some idea of where the forum might go from here on, what activities they might be to address these key messages, and I think we've heard that. So thank you very much indeed. We now have a reception, if I understand correctly, upstairs on the 3rd floor in the atrium. And we're back here tomorrow again at 9 o'clock. And we'll take forward a little bit more on exploring challenges and lessons learned, part 2. And Kimberly has got some.
I'd just like to ask if it's possible to do, for the forum members, to take 5 minutes to discuss the operational framework document. Are we prepared to do that?
Oh, yes, of course.
Oh, I didn't know you were. It was okay today. As we do not want that conversation to delay until next June.
I'm going to say, lest you leave early before tomorrow, the end of the day tomorrow. The question that Kimberly's asked is the operational framework. We sort of were waving it around last night, asking you to take a look at it. We would like to leave here with it approved by those of you that are members of the forum. Were there any serious concerns about it in your review at all? No? Could we have a show of hands of agreement with the operational? Outstanding. All
Yeah.
right. Timing is
Moved.
everything. All right. Thank you very much. And we'll go up to
You may
the
go
third
upstairs.
floor. They were afraid. They were deeply afraid they would be here discussing it. Thank you very much.
Are you going upstairs?